Discuss about levels of prevention. Okay, yesterday we discussed about how diseases are prevented. Okay, prevention of disease. In this class we will discuss the levels of prevention. Okay, this question comes in examination as such. Okay, explain the levels of prevention, and mostly it marks 8 to 10 marks. Okay, so it is a good question. Sometime they may ask in practical. Okay, so in practical they ask just enlist the levels of prevention. Then we can tell there are 4 levels of prevention. Okay, and if it is a lengthy question, then we have to explain. Okay, prevention includes a wide range of activities aimed at reducing the risk or threat of infection, threat to the health. There are 4 levels of prevention. Okay, yesterday we discussed only the preventive measures related to communicable diseases. Okay, but here during levels of prevention we discuss all types of prevention or all type of diseases, be it communicable disease as well as non-communicable disease. Okay, so there are 4 levels of prevention. Okay, so what are those levels? These are primordial prevention, primary prevention, secondary prevention and tertiary prevention. 4 levels of prevention are there. Now we will discuss them one by one. What is primordial prevention? Okay, primordial prevention is the level of prevention where we try to prevent even development of risk factor for the disease. Okay, so normally it is we can say well before the occurrence of disease. Okay, so primordial prevention is a new concept of prevention. Mainly it is used for chronic non-communicable diseases. Okay, so primordial prevention mainly focuses on the non-communicable diseases which are chronic in nature. Okay, primordial prevention is defined as the prevention of development of risk factors. Okay, not only disease, but we want to make sure that even risk factors are not being developed. Okay, so what is the example we can discuss here? It is the obesity and smoking. These two are risk factor of what? Development of heart disease. So here even we want to make sure that these obesity and smoking habits, they do not occur. Okay, so when we want to prevent not only disease but even their risk factors, then it is known as primordial prevention. Okay, and for applying the primordial prevention, what we do? We act much before the disease. For example, in this case, heart disease normally occurs in later stage of life, but if we want to prevent the risk factor like obesity and smoking habits, then we have to focus on the children so that they eat good food. Okay, and they do not develop habit of smoking. So we can say that primordial prevention are the measures which are applied much before the disease and where we want to prevent development of risk factors. Okay, the interventions to prevent the development of these risk factors are known as primordial prevention. It includes health education to children. Okay, during our school health activities, we can explain them that good habits, good food habits, nutritious diet, they all will prevent cardiac disease in later stage of life. Okay, because they will prevent obesity and dangerous habits like smoking. Okay, so this is primordial prevention. Here we also discourage the children from adopting the harmful lifestyles. Okay, lazy lifestyle. In this way we can prevent. We develop or we explain them that we should develop healthy lifestyle of morning walk, running, daily exercise. Okay, in this way we can prevent the risk factor for the chronic diseases. Okay, so this is all about primordial prevention. Now we come to primary prevention. If we fail to apply primordial prevention, then we have to apply primary prevention. Okay, because the client has reached to that stage. Now he is obese, he has the habit of smoking, but still what we can do, we cannot apply primordial prevention here. What we can do, we can apply primary prevention. Okay, now we apply the measures or the activities which stops or prevent heart disease. Okay, at this time we cannot apply the methods which stop obesity because he is already obese. Then we apply the methods which prevent heart disease. So the measures which are applied to prevent the disease to occur, these are known as primary prevention, and they are applied just before appearance of the disease. Okay, so what are the primary prevention? Primary prevention aims at prevention of the disease or injury just before they occur. This is achieved by preventing the exposure to hazards that causes the disease or injury. Okay, now we can tell them that okay, now you have to stop eating more fats. Okay, because this will increase the cholesterol and this may lead to heart disease. Okay, so that activities will be included here. We ask him to alter the unhealthy habits and develop alter the unsafe behaviors so that the disease or injury can be prevented. Okay, and we also try to increase the resistance or immunity against the disease. Okay, so that disease will not develop. So these measures will be known as primary prevention. Primary prevention is achieved by the measures designed to promote general health and well-being, especially for non-communicable disease. Okay, so here what we do, we explain them that healthy habits should be encouraged. For example, education about healthy and safe habits such as social distancing for the communicable diseases. All these measures can be applied for both communicable as well as non-communicable diseases. Okay, hand hygiene, respiratory hygiene, these are applied for the communicable disease just before occurrence of the disease. Clear? Up to this level we have understood what is primordial prevention and what is primary prevention. Both are applied before occurrence of the disease, but primordial are applied much before the disease and primary just before the disease. Now next level is secondary prevention. Okay, secondary prevention is applied after the disease occurs. Okay, because we have failed to apply primordial prevention and primary prevention properly, so now disease has occurred. Now what measures will be applied? Now we will focus on prevention of spread of the disease. Okay, and prevention of complications. Okay, so those measures will be known as secondary prevention. Okay, we are still trying to prevent something. Okay, so secondary prevention can be defined as the intervention which control the progress of disease. Okay, and spread of the disease. In case of chronic disease, it prevents the progress of the disease, and in case of communicable diseases, it prevents spread of the disease. Okay, and also prevent the complications. So what measures will be applied in secondary prevention? These measures will be known as early diagnosis by screening and testing as well as prompt treatment. Okay, we will diagnose the disease early by different tests and we will start treatment. so that disease progress is prevented. Okay, and we try that client recovers as early as possible. Okay, so these measures will be known as secondary measure, where main activity is early diagnosis and prompt treatment. Okay, so that we can reduce the number of cases and carrier and reduce the chance of disease transmission. Okay. In secondary prevention, we also try to restore the health, okay, by good or early treatment, and we also protect our other community people from getting the infection from the disease. If we treat early, the case will not be able to spread the disease. If we treat late, by the time we start disease treatment, he will have transmitted the disease to other people. So treatment should be started as early as possible. Okay. So in this way we can apply the measures of secondary prevention. The secondary prevention need clinical medication or hospitalization. Sometimes just medication in the OPD, and sometimes these measures may need hospitalization, so that treatment is given. The secondary prevention is important in controlling the transmission of disease and prevention of complications in a particular case. The drawback of secondary prevention, there are some drawback also of secondary prevention. What drawback is there? That in this case the client has already suffered from the disease, and the pain or the problem he has, because the disease has occurred, so the client is already suffering from pain. But still we should apply the secondary prevention, so that complications are prevented and the spread of disease in healthy people, among healthy people, can be prevented. Okay. Now we come to tertiary prevention. When we will apply tertiary prevention? Actually, the tertiary prevention is applied in very later stage of the disease, where the client is recovering now. Okay, we have treated, now he is being recovered, and we are sending him to the home or to the community. But still, we try to prevent something. What we will prevent in the tertiary prevention? Any idea? We prevent further complications, and we also prevent from social injustice. Okay, because if the client has suffered some paralysis during the treatment, so now he will not be able to earn, okay, for his family or for himself. So we have to use the measures by which we try to rehabilitate the client in the community. Okay. So these measures are known as tertiary prevention, which we apply after completion of the treatment. Okay. So tertiary prevention is defined as the intervention which reduce the or limit the disabilities, okay, minimize the suffering caused by the disease, and promote the patient's adjustment in the society. When he reaches back, his adjustment should be proper. The main intervention in tertiary prevention include health promotion. We try to promote the health. Disability limitation. Okay, we try to limit the disabilities which may arise, and we try to for the rehabilitation of the client in the society. Rehabilitation may be in the form of physical rehabilitation, okay, where we can provide him some prosthesis, okay, and social rehabilitation, vocational rehabilitation, so that he can earn money for himself or his family. Okay, in this way, we try to rehabilitate the client in the community. Okay. Tertiary prevention is achieved by mainly health education, sometimes environmental modification for him, nutritional interventions, healthy diet, lifestyle changes, disability limitation, and rehabilitation, which include medical rehabilitation, vocational rehabilitation, even social rehabilitation, psychological rehabilitation, and creation of support group and self-help group. Okay, what are the support group or self-help group? Any idea? जो उसके जैसे जो लोग हैं, हाँ, उनके साथ उनका एक ग्रुप बना देते हैं. ओके, वी give the numbers or contact number or WhatsApp number of the people who are suffering from same type of the disease, and they have recovered. So how they have recovered, he can contact with them, how they are living now and what they are doing for their earning, so they can contact them. So this system is known as creation of help group or self-help. Okay, so they will support each other and get benefited. Okay, so these are the levels of prevention which can be applied for both communicable as well as non-communicable diseases. Okay, so this is very important question and many times it is asked in examination, theory as well as practice. Okay. So I will send you the notes so that you can